Right. So,
Okay, well, good morning, everyone. Glad to see each one of you. Welcome to this Aetna webinar. Thank you, Renita. Renita Small is with us from Aetna today. And my name is David Rassam. I'm a sales brokerage sales advisor here at Insurance Advisors Direct with IAD. IAD is a full service FMO, and our commitment is to make agents successful in the field. We provide our agents with wide spectrum of services, including education. We educate you about Medicare, life insurance, ancillary products, all of those that we have, marketing materials, sales tools, and much, much more. So if you need any help with anything, I'm going to email you after this meeting so you know how to contact me. Today, I would like to, again, introduce Renita Small from Aetna, and she will talk to us about the great Aetna D-SNP plan and why you should present it and sell it to people who are dual eligible. If you have any questions throughout this presentation, the question box is open. You can ask any question that you have, and we'll get you an answer either throughout the presentation or at the end. Feel free to write your question, and then we'll take care of it. So now, without further ado, Renita, please take it from here.
all right. Good morning. Thanks so much, David. Thanks for inviting me
You.
to share Aetna's DSNP information with you and with your IAD team. So first of all, we'll just start, by introducing the Michigan team. My focus is going to be on the DSNP portion of Medicare Advantage today. The Michigan team is Dan. Well, actually, I'm going to go ahead and go to the next slide because I like to show our pictures. So that's Dan Dombrowski. He's been with Aetna for about 7 years, and he shares the Southeast market with me. He also services the mid market for Michigan. And then myself, I came on board with Aetna just before 2023 AEP back in September of 2022. And I share like I said, the Southeast Michigan market with Dan. And then Ryan Turkoleski is our third team member or broker manager for Aetna. And Ryan services or is the broker manager for Northern Michigan, Southwest, and the UP area. So just a few facts about Aetna. So Aetna is 170 years old, and we've been in the Medicare business since Medicare started. When the Detroit Tigers were founded back in 1894, Aetna had already been in business for 43 years, So Aetna covers over 47 million members throughout the country. So basically our goal for Aetna Medicare is to help our brokers navigate Medicare and the Medicare Advantage plans and to help our members get the health care that they need, of course, from the doctors that they know and that they trust. So we are number 4 on the Fortune 500 list for Aetna CVS with over 300,000 employees. And another fun fact is that we paid our first Medicare claim in 1966. So quite a while ago. I was a thought I was here in 1966, not in Aetna, but in the world. So I'm dating myself. So for the dual eligible special needs plan, like I said, we're gonna focus on that for this webinar for DSNP specifically. Our large expansion occurred last year during our 2023 AEP. So we added 33 counties. So that's huge. So that was a very big deal. So we have now a total of 39 counties that our DSNP covers. And then that footprint allows for access to over 225,000 dual eligible prospects who live in these counties. So just a list of the counties alphabetically. So our DSNP, a summary of the DSNP plan here, it shows the counties here at the top. And I won't go down line by line, but our DSNP is a $0 cost for our DSNP members. Of course, no premiums, etc. So we're getting down to the dental. Our dental benefit was expanded to $3,000 in 2023. The vision, $500, and I'm going to talk about that a little more in detail in a few slides from here, and our extra benefit and the over-the-counter card, which is very popular and it's a great benefit. And then we'll talk about the transportation, hearing, the gym membership, which is Silver Sneakers, very popular. A lot of people ask about it. And then our meals. I decided to include a list of the hospital networks and the hospital providers that service our primarily the Southeast Michigan market. A few of the hospitals listed here are, beyond the Southeast Michigan market, but a lot of your brokers, your agents may have clients in those areas as well. But I highlighted those hospitals and hospital systems in the immediate Southeast Michigan market. And as you can see, we quite a few of probably the most utilized hospitals in our network. But we also have hospitals that are in Genesee County as well, and you see the other providers for the outskirts of the Southeast Michigan market. A lot of people ask about U of M, and yes, U of M providers are included. Probably not all U of M because it's so large, but of course, agents will have to do, their due diligence, make sure that specific U of M providers are in the network. And this is not a full list, by the way, so there's more. I don't have them here. So who is eligible to join our D-SNP plan? I have here a list that shows the 4 categories that are the equivalent of a full dual beneficiary. So to the left, the first column, it says the Medicare Savings Program category. I'm going to talk about that a little more as we advance with the slides for the Medicare Savings Program, because I do like to define it more and just, be a little more descriptive about Medicare Savings Program. But the categories that Aetna recognizes as those who qualify are the QuimB, the QuimB Plus, the Slim B, and the full benefit dual eligible. So I also am going to share something that shows a little more detail about the acronyms that we use. And we use the acronyms so often. And, I just try to keep in mind that, individuals who don't see these every day have to be reminded of, what does that acronym stand for? What does it mean? And, why does Aetna accept these particular ones and maybe not all of them? So we'll talk about that in detail in a few slides down. Well, quite a few slides down. But want to show the next slide that also still talks about who's eligible for our Aetna D-SNP plan. And again, the 4 levels, what we just went over. And then Aetna does make it quite easy for agents and brokers to determine who is eligible for our D-SNP plan. They can call broker services and select option 7. They have to have the beneficiary's Medicare ID available, the last name, and the date of birth. And the broker services area will let the agent know if that beneficiary does qualify for our D-SNP plan. Agents can also determine eligibility very quickly using our Think Agent enrollment platform. So that would be another, conversation, going into Think Agent. I won't go into that, but very useful and efficient tool that we have. And it's been, upgraded and updated actually several times this year in 2023. And then I also want to point out that members who are on a spin down for Medicaid are not considered eligible for Aetna's D-SNP plan. And I'll talk about that, not the spin down in detail, but I'll talk about why Aetna doesn't consider that a full dual beneficiary for the spin down. So Aetna has a very robust network. Our D-SNP plan actually utilizes the network that Aetna has for our Medicare Advantage PPO and HMO plan with the nationwide coverage. So we have roughly 93% of doctors in our network in Michigan. So that's quite quite a lot, of coverage, 93%. So really, with the inverse, only 7% of doctors are not in our network for our D-SNP plan. I will just go back and say as far as the network, one of the other reasons why Aetna's network is so vast is because even with the Medicare Advantage PPO plan, all of our plans use the same network that was established when Aetna began covering group members. So group retirees, another segment of our business, but Aetna uses that same group network for our Medicare Advantage plans. So when I say group network, I'm speaking of, say, retiree groups, from, various employers, throughout the nation. That network was built based on doctors who those members use. And of course, adding doctors on year after year. So that just makes for a robust network, and that's why roughly 93% of doctors are in our network in Michigan, and a large percent of doctors are in our network throughout the country. And then no referrals are required. So that's a great thing too. People don't necessarily want to have to call a doctor or have their doctor refer them to a specialist. As long as that doctor or specialist is in our network, they can make an appointment with that doctor under our D-SNP plan. Cost sharing for our D-SNP members, $0. So, of course, $0 out of pocket for all covered Medicare medical services within our D-SNP plan. Our members pay $0 for all the drugs that are in our formulary for D-SNP. So our formulary covers medicines that are on tiers 1 through 5, but if the medicine is in our network, I'm sorry, if the medicine is in our formulary, then it's no cost to our D-SNP members. And our D-SNP members can go to any of our preferred or standard network pharmacies. And there is a website that's available where members can find out where our preferred and standard network pharmacies are located, CVS's and many other pharmacies. And our members can also call the number on their ID card to locate the pharmacies. So one of the exciting things about our D-SNP plan for 2023 was the introduction of the new Flex card. So that's a card that goes along kind of hand in hand with our over-the-counter benefit, which I'll talk about, I think, in the next slide. But this Flex card is a card that's sent to our member, and it is a prepaid MasterCard, I believe. Yep, prepaid MasterCard. And it's loaded every quarter with $180. So, that's a pretty big deal, $180 per quarter. And it can be used for healthy foods, and they can shop at the retailers that you see listed. As far as the groceries would be, primarily the Walmarts. Myers is not listed here, but they can go to some Myers. There's a list of participating retailers that our members can access on either online, or they can contact the number again on their ID card. A big deal is that our members can use this card for utilities. They can pay their phone bills, their cell phone bills, electricity, internet bills. I mean, these are things that are going to help our members or your members continue their standard, way of living, just in case they run short. That's a great benefit to have. That could mean the difference between heat, for some people. So that's just a great benefit for members to have access to and to know about. They can also use this benefit for transportation, whether it be public transportation, or the ride shares like the Ubers and the Lyfts. And a big deal also is that they can use this card for gas. There's a specific way to use the card for gas. They would have to use the pump. They have to pay at the pump for the gas. They can't go inside of a gas station, and pay for the gas, because there's no extended monitor for that in place. So for example, if someone used that card and they wanted to go into, a store and purchase gas, but they also wanted to get, chips and, a beer or whatever, they can't use it inside of a gas station, because it's only, of course, allowed for just strictly gas. If members do have any issues with the card, please contact myself or member services to let us know, so that if there are any problems, we want to make sure that we track, any issues that come along, so that we can get those issues, fixed right away. And again, like I said, it's a MasterCard. There's no PIN number for the card, but they do have to activate the card once they receive it. And this is specifically talking about our over-the-counter benefit. We've added quite a few items to our over-the-counter catalog. So now there's over 800 items in 2023. There were about 350 items. What I learned is that, for example, the items that were added, a lot of expansion was due to, say members needed to use the over-the-counter benefit for adult briefs, for example. Initially, or just even last year, the catalog contained a pack, say a pack of briefs, that was, several sizes, and they would, send that to the member. So Aetna asked for some feedback from our members, and in a lot of cases, members wanted a particular size, or to, have more, of a count, more in the package, for example, for adult briefs. So they expanded the items to have more of a category that our members could select from. Different sizes. They could order, instead of say 50, they could order 100. I'm just saying those numbers. I might not be right on the numbers, but they expanded the choices, so that makes the benefit much more beneficial for our members. The catalog can be used. It's going to be mailed to all the members first of all, and the catalog can be used in stores, in select stores right now, to use the benefit in select CVS stores, that is, or they can call in their order, or they can order online. Starting in this is some news right here. Starting in July of this year, all of our CVS stores that are freestanding, they have a pharmacy attached. Our members, we will be able to go into any of the CVS stores starting in July and use that benefit. And there's instructions actually on the catalog that will tell the members what items to look for that they can use. I don't want to say purchase because they're not actually purchasing anything, they're using that benefit. But again, they can use that benefit either in the store or the other ways. The members can order quarterly depending on what their benefit is. So for the D-SNP, it's $360. They can't order more than what the benefit, what their allotment is. So for example, and they can order 3 times per quarter within that quarter. I'm going to also show just an example of the over-the-counter for the D-SNP over-the-counter. Let me see if I have that. Oh, David, I don't. Oh, here I can. I think I can share my screen. So yeah, can you see the over-the-counter catalog,
No,
David? You can see that. Okay.
no, not yet. But
Oh,
I have a question
sure.
actually. Is this the 360 dudes? Does it roll over
Good
into?
question. Our benefit does not roll over,
Okay,
so they
so they
do
got to
have to
be
use
used.
that benefit within that quarter. So you are not able to see my screen?
No, not.
Oh, okay. I think I
Uh,
need to do this. I think if I click on
you
here,
need to unshare. I think. There we go. We see
can
it
you
now.
see it now? Okay. So I just wanted to quickly just show what the over-the-counter for the D-SNP benefit catalog looks like.
Okay.
And it shows specific instructions on how to use the benefit. They can use it in the store. And also, I highly recommend that the agents let the members know if they're going to shop in the store and use their benefit,
Mhm.
take the catalog with them so that that way they can see what items are available for them. And there's going to be a particular section or a scanner in the store where they can see what items qualify for the over-the-counter catalog. And one more thing I wanted to point out: once they are in the store and they're using the benefit, the catalog actually has direct instructions for the cashier, just in case the cashier is unsure. I also like to point this out so that there won't be that uncomfortable nervousness, if the cashier is not familiar, some people would just say, well, you can't use that here. They'll just automatically
Mhm.
revert to that, but that's not the case. So the instructions are specific here. So if that cashier is not familiar, that member has the protection of having this catalog. Whereas that cashier can run and get their manager if they needed some assistance, but the member will be able to walk out of the store with their, items that they've selected, from their benefits. And then just a couple of things more, just wanted to point out, online instructions are here for the member and the phone instructions. So members can actually call the number from their home. They can call this toll-free number and order their items, but they can, or and talk by talking to a live agent. But they can also, some people don't want to talk to an agent necessarily, but they can place their order through a like computerized system. They
Mhm.
call it IVR. Yeah, I think it's a virtual representative, whatever the IVR stands for. Okay.
Okay.
So, and then the catalog doesn't show a lot of pictures this time. It's just the item numbers, but everything is here. I will
Is
go
this
back.
available? Is this available on
Producer World.
Producer World?
Yes. Yep. So agents can order extra. catalog so that they can have them on hand, if they're in person or, at an event, or just, just to have them so that they can, if
Great.
they're talking with people about a potential appointment. I always like the fact that when I was writing, I would have a catalog right there with me so members can see what it is that they would be able to use the benefit. All right, so just want to make sure that I'm back to, can you see it? Can you see the presentation?
Not yet, no.
Okay, let me go back to it. Back. Is it back?
It is back. Yep.
Okay. All
Mhm.
right. So just to get into some of the specifics about the benefits. Okay. So we talked about the over the counter. And so we offer the fall prevention. So that means that, say, if a member needed to have, say, guardrails put up, in the bathroom, Aetna will pay for up to $150. They'll pay for the purchase, but they won't pay for the installation. But, they still, the member would be able to get that benefit. If they needed assistance with that, we probably have something else available that will help them get the assistance that they need. I'll talk about that in a few minutes as well. Transportation, we cover 51-way trips, and these would be to, what we call plan approved locations like doctor's visits, pharmacy,
Mhm.
gym. They could, use this for the gym membership. And one of the things that does stand out is the 50 rides, the 51-way trips, or the 25 round trips. They cover up to 100 miles each way. Some plans don't cover up to 100 miles, and
Wow.
sometimes, depending on that particular beneficiary, they may be seeing a particular doctor that they have to see, and that doctor may be further out than what maybe another, carrier might cover, but yeah, we cover up to 100 miles one way for the transportation benefit, and that's something that I like to point out and let the agents know to make sure that they let the members know, or the prospective members. For the hearing, we cover $2,000 benefit per ear each year for our hearing aids. For vision, we cover up to $500 for eyewear. And of course, the exams are included in the benefit. So members don't pay anything for the exam, and they get up to a $500 benefit for the eyewear or contact lenses. And then for the personal emergency response, that's included as well. Our members will receive that. It's like remember the commercial, I've fallen and I can't get up, the button that they can push. So that requires some setup, once they get it, but then they have access to that personal response system. Also, moving on, I talked about the over-the-counter benefit for $360 per quarter. The meal benefit, if a member was hospitalized, once they're at home and recuperating, the actual doctors doesn't have to contact Aetna. Aetna will know in our system that the member was hospitalized, and they'll reach out to that member to find out if they want to have those meals sent to them. So, and the meals are, I've seen them. They come with instructions, and they're better than, the average TV dinner. But the meals are nutritional, and the meals are based on that member's, I guess, health history as well. So, for example, for the dessert, a member who has, who's a diabetic, they won't get like cookies for dessert. They may get like fruit, so it's going to be in line with what their medical history is. The model of care, I'm going to talk about that in a little detail because that's something unique for Aetna. Our members get access to a personal care team that's designed based on them, based on what their personal needs are. And then finally, the silver sneakers gym membership, which is very popular. So our Aetna D-SNP model of care, that's where every D-SNP member is going to have a personal care team. So they also get access to a nurse care manager. And they're going to actually have access by phone to that person. What that team does is it consists of a registered nurse, a social worker, a care coordinator, and a member advocate. Once I realized that this was available to our D-SNP members, I was pleasantly surprised. When I was writing, I was looking at certain categories here, and I'm saying, wow, sometimes, D-SNP members do require, more hands-on, involvement. Aetna recognizes that and provides just that. So depending on what they need, it's good for the agent to complete a health assessment, when they enroll a member, and that's great. But what this does, Aetna actually takes it to a next step. When they reach out to the member, they provide a complete health assessment. So that way they can create like a personal care plan for that member. And for example, just maybe going down to the care coordinator, you can see what the services are for each of the team here for the members care team. The care coordinator is going to make sure that if that member needs assistance making appointments, making sure that they get those appointments made, that's what they're going to do. So they provide all those extra pieces of service that that D-SNP member would need. So that's a great, I guess you could say, addition. It's been Aetna has had this service in place, but it's a great benefit that the members in many cases they don't know that this is available. So I always like to make sure that our brokers know to make sure that the member utilizes this benefit. But again, Aetna is going to reach out to the member. It's up to the member to look at their mail. In many cases, some of the members won't, read their mail. Just, make sure that the members know that, when you see, when you enroll and you get that membership from Aetna, look at your mail as well. Don't just put it
Mhm.
away, because in most cases, especially early on, it's going to contain some, great information for that member.
Renita, we have a question here.
Sure.
Okay, says, does the benefit with the emergency response system allow the member to select the type of device they wish to use? For example, watch, necklace, etc. And is it a two-way device without using a personal phone?
Oh, that's a good question. I think there's going to be one particular device that's offered as far as a two-way device using the personal phone. I'm sure it is because I think it would have to be, but let me follow up and get that information to
Okay,
you, David, because I'm not 100% sure.
okay,
But I do believe it's one type of device
okay.
that's offered and
Then,
paid for.
yep, I will forward the question to the person who asked it. So, yep, thank you.
You're welcome. Okay, so for our dental coverage, it's $3,000 for the annual benefit, zero deductible. We have a strong dental network. The network that's available to our DSNP is our Aetna Dental PPO network. So again, back to the large network that we have, and our DSNP members have access to the same network. It includes all preventative and comprehensive services at 100% up to the benefit at zero cost to the member, and it is available to the member to use on the first day that the plan becomes effective. So this is a separate dental benefit. They don't take a look back at what services the member had, from some prior plan. It starts as a new fresh plan on the first day that the member has our DSNP benefit. And then the only exception or the only exclusion on anything that's covered generally is, all the services generally are covered. The only thing that's not covered is cosmetic services such as teeth whitening, not cleaning, but teeth whitening. And I think I have another. So this is a list of dental services that are included, but we just like to just make it simple and say pretty much everything is covered except for the teeth whitening and cosmetic services. For eyewear, again, the benefit for eyewear is $500 if a member does need to have glasses or contact. And the eye exam is included $0 in a free eye exam annually for our members. Our members can go to the website that's highlighted at medicare-vision.com to find out what locations accept the Aetna Vision Vision benefit, and they can also call the number that's on their ID card. But I have listed down at the bottom some of the more common optical locations that accept our Aetna Vision membership. They include Lens Crafters, Target Optical, not included here, but the Henry Ford Optimize is also in our network for vision.
Great.
I think a lot of people want to know about that one. Pearl Vision as well. Our Silver Sneakers program. So this is our gym membership that is more than a gym membership. With Silver Sneakers, our members can go to any location, so they don't have to be enrolled in one location and then, be, required to just go to that location. They can go to any location. So in addition, our members can have access to on-demand exercise programs. They can also have access to live interactive classes. Just a great benefit, and a lot of people look forward to it because it provides an outlet for a social connection as well. Wanted to add one more thing about our silver sneakers. We always like to make sure that our members know about the silver sneakers tuition rewards. So that's a benefit within silver sneakers that allows our members to designate a family member, and it could be more than one family member, but they can actually designate their younger family members to be awarded silver sneakers tuition discounts. So there's a process in place where the member can determine who the designated beneficiary is for that benefit. The member simply can start out by going to a gym, and once they go to a gym, they get 1,000 points just for signing up. Also, once they attend a gym, for every so this paragraph here, that's for every month that they visit a Silver Sneakers participating location 7 times or more within the month, they'll get an extra 250 tuition reward points to go toward that tuition rewards account. That can be up to $250 in tuition savings. That's dollar for dollar each month just for working out, going to the gym. So that's a great benefit. So members really like this benefit because that's a way that they can give back to their loved one. So they may not have, they may want to, contribute to that younger person's higher education. This is the way that they can do it. It's becoming very popular and more well known. Of course, our 24-hour nurse hotline, they can call a nurse. Our members can call a nurse anytime. In many cases, our members, some members actually call the number to make sure somebody is, going to respond, and when they call, someone will respond, and the purpose is to just to provide assistance, understands their medicines that they're taking, for example, but also to if a member is feeling a certain kind of way and they're not sure if maybe they something they ate clashed with a medicine that they take, or they took two medicines too close together. The purpose of this call is to let a nurse know, what the specifics are, once they noticed, that they started feeling different, or, based on what their medical condition is, they could use this number could really be a lifesaver, because that nurse on the other end of the phone could really advise them, okay, well, based on what you're telling me, Mrs. Jones, we think that you need to go ahead and hang up and dial 911. Or, you know what, drink some water, make sure you eat, and go ahead and call your doctor. Make an appointment and get in to see your doctor as soon as possible. Or, are you near an urgent care? Try to get over there as soon as you can. That kind of advice. So that's important for people to have access to, someone outside of their, outside of themselves, because they may be a loner. They may not have some family member with them or coming in to check on them. And this nurse advice line could be, just could be a lifesaver for them. So this is really a summary of everything that was discussed as our benefits for our D-SNP plan. And one of the reasons that I like to show this is because this slide is because it reminds me to talk about the assessment, the health risk assessment that our brokers can perform with the member, after the enrollment, and they can also earn an extra $110. So we don't want to leave that money on the table. One of the other things that I wanted to cover was just talk a little bit about D-SNP and the MMP. So the MMP is where, in certain counties in our state, the state has that MMP program, which is very similar to D-SNP. But what is different about the MMP is that it has something in place that's called passive enrollment. If members some of our D-SNP members may get a letter from the state saying that they're going to be enrolled into a Medicare, Medicaid program or plan. In some cases, it may be good for that member, but in most cases or some cases, the member may not want to have that changed for them automatically. They may want to stay right where they are with that particular D-SNP plan. And if it's your member, they're enrolled in the D-SNP plan that you enrolled them in, where you are their agent of record, etc. But I just wanted to kind of give a little background about the MMP plan and just some highlights, and maybe just just point out a few things so that you can be in a better position to help the member react or respond when if they receive a letter from the state indicating that they're being passively enrolled into the MMP plan. So the MMP plan in Michigan is in 10 counties across 3 regions. And the regions that are most primarily affected for us would be Wayne County and Macomb County. And this picture just shows like the overlay of the MMP versus the D-SNP as far as count that overlap. And then the green is the two counties that I pointed out, Wayne County and Macomb County. And I'll just stop here and just talk a little bit about the MMP. So the MMP came into play about 8 or 9 years ago, where the state, in collaboration with specific carriers or with specific providers and specific carriers, not all carriers participate with the MMP plan. Aetna does happen to be one of the carriers that does have an MMP plan, but this MMP plan was put in place to provide an extra layer of care for individuals who are dual beneficiaries. So in some cases, it covers more than what the D-SNP plan covers. And it was started out being called a pilot program. I don't think they call it a pilot program anymore, but it's not a permanent program, but it is a program that's in place where individuals are passively enrolled in the plan. So just kind of a little comparison of the D-SNP and then comparing that with the MMP. So the D-SNP is a Medicare Advantage plan, and they follow Medicare Advantage rules. The D-SNP is going to always cover the benefits that the original Medicare covers, but the D-SNP is also going to have individuals who qualify for both Medicare and Medicaid. I talked about, and then let me see. So here's where the D-SNP covers benefits that are covered by original Medicare, but also D-SNPs offer, of course, the extra benefits that I just went over. So that's what makes the Medicare Advantage or the D-SNP plan appealing to many dual eligible beneficiaries. For the MMP, my purpose here is just to kind of compare the D-SNP to the MMP. So the MMP, it's like a combination package. They're going to members receive one ID card and use it to receive all of their Medicare and Medicaid benefits. So the MMP is made up of doctors, hospitals, pharmacies, long-term service providers, and more within, like under that one umbrella for the MMP. So the Medicare Part D, Medicare and non-Part D drugs, Medicare Part D and non-Part D drugs are included here for the MMP. The MMP in Michigan is called My Health Link. So I'm sure by now all of us have seen a card that says My Health Link. Not all individuals get chosen to be passively enrolled into the MMP plan. Some individuals actually choose to enroll into an MMP plan because it offers certain benefits that are called waiver benefits. And I'll talk a little bit about that in a minute as well. And it says here that an MMP must follow Medicare Advantage rules, but at time, they must go beyond the Medicare requirements since the Medicaid rules layer on top of the Medicare requirements. So there's more partners with an MMP, more services in some cases are provided to that MMP member. The D-SNP members, the D-SNP benefits are here. Here's a review of the standard D-SNP benefits, and basically that's original Medicare. That includes the prescription drug coverage. The MMP benefits include, in a lot of cases, a few more benefits, but the thing that I wanted to get to, and the reason I'm showing this is because a couple of important points. Now, the MMP benefits include waiver. The members have those waiver services. So one of the most popular waiver benefits or waiver services that a dual beneficiary may already have before they get enrolled even into a D-SNP plan is they may have that, it's called a chore provider. There may be more than one way to describe it. They may call it a health or let's see, what we call it. But anyway, they call it's a chore provider. So that person is designated from, generally that beneficiary chooses that person to act as their care provider at home. So if you enroll a person into a D-SNP plan, not from an MMP plan, if you enroll that person, a beneficiary, into a D-SNP plan, and they already have a chore provider, there may be an interruption in that service. So that's like one of the most important things that sometimes a D-SNP person, a dual beneficiary has, is that selected person who comes to their home to help them with, chores. They'll go grocery shopping for them, etc. But that person gets paid a check from the state. That check may be interrupted. And if that check is interrupted, then that D-SNP member, if they become a D-SNP member and that check is interrupted, that can cause a problem. So you want to be aware before you enroll a D-SNP individual, a dual beneficiary into a D-SNP plan, find out if they have a chore provider and find out if they're okay with that chore provider not being paid for a couple of months, because they will have to reapply for that chore provider to continue to provide that service. Once that's in the system again, they'll continue to get paid, and they'll get paid retroactively, but there will be like a gap in between payments. So I just wanted to point that out because that is very significant. Also, let me just go back, and I'm almost, David, how am I on time?
You're doing good. You
Okay.
got about 9 minutes.
Okay, so let me just, I talked about the Medicare savings program. I want to look at something, I just want to point something out about the Medicare savings program because we talk about it a lot. Can you see my screen, David? It says Medicare savings program here.
Yes, I can.
Okay, so, and I'll share this with you. I'll send you this form in the email, David. This is, to me, is very helpful because it spells out what this Medicare savings program is. And what it is money, funds, FUNDS, that's provided at the government level, at CMS level, and it's administered at the state level. So this money is administered at the state level. A person can apply for the Medicare savings program. In many cases, their DHS worker or their caseworker will apply. They'll automatically apply for this program for the beneficiary. But what this does, though, it helps a member pay for a certain for D-SNP. Everything pretty much is covered. But for this Medicare savings program, this is what I referred to when I started talking about the levels of beneficiaries that Aetna will accept under D-SNP. So in many cases, we might have someone on that, we call it a spin down for Medicaid. This Medicare savings program may be something that can help that member become a QIMBY or a QIMBY Plus. So I just always like to refer to this so that agents can be more equipped with as much information as possible regarding the Medicare savings program. So now I'm going to go back and I'm almost done here. Go back to my presentation here. So this is another slide that shows some of the waiver services that a dual beneficiary might have access to. And the reason I'd like to show this is because sometimes when individuals say that, oh, my member got this letter from the state and they're going to be passively enrolled, sometimes it might be better for them to go to an MMP plan. You don't necessarily want to because this is a non-commission space type of dual plan, but just keep in mind that we also still want to keep that members or the beneficiary's best interests at heart. But if a member gets that letter from the state and they're saying that they're going to be passively enrolled, that member does have the option. They don't have to say, oh, okay, I'm going to be enrolled in something else. They can opt out. So there's a phone number here that the member can call and they can opt out of that MMP plan, that they won't be enrolled. They won't be passively enrolled in it. Once they opt out after May 1st, which is this coming month, next Monday, once a member opts out of the MMP, they should not or they won't get any further letters for the MMP plan. If they choose to go ahead and become enrolled in the plan, then they'll be enrolled effective whatever the date is on the letter that they received. In many cases, the D-SNP member does not want anything to be changed because they're enjoying the benefits that they enrolled in on purpose, to get the transportation, the, OTC card, the flex card, the vision benefits, et cetera, et cetera. In most cases, a person who moves over or if they're, their representative, a family member, power of attorney, they may have them move over if they see that might be for the best benefit of that person. And that's generally a person who requires much more, attention, medical care, et cetera. And then the last thing that I will say about the MMP is it is going to sunset. It's going to phase out, and that will be in 2025. So that MMP will be over in 2025. And I believe that is it for my presentation. And then, if a broker is not certified with Aetna, we invite you to become certified with Aetna so that you can get going and selling, and we can help you, increase your Aetna business. One thing about Aetna is we do require that once you become certified with us, we do that require that you attend at least one of our market specific trainings, and that's going to be virtual. And the way you find those trainings is you go to the website for aetnamedicareagenttraining.com. And that
Mhm.
will be on the Producer World website as well.
All
Member
right.
services, yep, number for member services, broker services, and that is it for my presentation.
Yeah, thank you, Renita. Really, this is great
You're welcome.
information. I'll tell you,
Awesome.
I'm a big fan of the Aetna D-SNP.
We
You know that.
appreciate it. I'm glad that you are. Yeah.
Yeah.
And I can tell
And
that you are.
yeah, thank you for doing this presentation, and thank you all for attending. Now, if you are not appointed with Aetna yet, I'm going to send an email. All what you need to do is to respond back, and you want that contract to be sent to you. There are two contracts. One is for the MAPD and the PDP, and also there's a separate contract for the supplement. Usually you get both of them, or if you want one, that is fine. But yeah, so you can reach me at 800-381-0977, and I'm an extension 127. If you have any other questions, follow-up questions, please go ahead and email them back to me. I'll get with Renita and we answer them. So, but thank you very much for all attending this wonderful webinar. And thank you, Renita.
You're welcome. Thank you. Thanks,
Yep.
everyone.
Thank you.
All right. Take care.
Have a great
Thanks so
day.
much. You
Yeah.
too. Bye now.